Their small movements can make you happy. Some behaviours make you obsessed. A culture in turn to an autistic culture.
Thousands of children each year are diagnosed with various disabilities. These numbers continue to grow as the rise in multiple birth increases. When people refer to autism today, they are usually talking about autism spectrum disorders, which are 5 complex, brain-based disorders that affect a person's behavior as well as social and communication skills. The Centers for Disease Control describes ASDs as developmental disabilities that cause substantial impairments in social interaction and communication and the presence of unusual behaviors and interests.
Autism has no cure. It's not a disease to cure. It's not a virus or a bacteria to cure. Autism is a disorder that affects function of cells and the anastomosis between them. And the only way to compensate for that is through exercising the child by repeating things until he gets it and move on.
Many people have unusual ways of learning, paying attention, and reacting to different sensations. The thinking and learning abilities of people with SCN can vary from gifted to severely challenged.
There's no cure for autism. One of the most successful tools to treat autism is applied behavioral analysis. It's a research evidence-based programs given to children to teach them, but in an alternative way. They don't learn the normal way like a typical child. They need to have more visuals, more tactile, more sensory, and more repetition. The more you teach them, the more they get it. And that's how you can teach a child and try to re-establish the connection between the brain cells and have the child manage to learn a lot of skills that he lacks at the time of diagnosis. We always like to see the children very early, before the age of 3 or 4, around the age of 3 or 4, because this is the right age to teach the child a lot of things and the brain is able to adapt to all these changes. We cannot say that all children can be treated. Some children will move very fast on these programs, and maybe 6 months of treatment plan, proper program and comprehensive therapy. When we say comprehensive, we're talking about 40 hours of therapy per day, one-to-one.
Scientists agree that the earlier a child receives early intervention services, the better the child's prognosis. All children with autism can benefit from early intervention, and some may gain enough skills to be able to attend a mainstream school. There is no cure for autism, and most individuals with ASD will need support and services throughout their lifetime.
There's no cure for autism, but it is treatable. The best researched method is applied behavioral analysis, where the child receives a comprehensive therapy of one-to-one. ABA programs usually have goals and objectives that meet what really the child needs. Every child will get an evaluation, will get a program which looks at the areas of deficit and the skills that we need to teach the child. So the child can learn how to comply, how to sit, how to function, how to help himself, and later we teach him the academic skills, which is reading, writing, memorizing, as he progresses towards school. The ABA therapy helped many children to be mainstreamed in mainstream schools in the States and in Canada and many other places in the world. And here in Dubai, we've managed to mainstream about 70% of our children in normal schools with typical peers. A combination of ABA therapy with speech and language therapy, vision therapy, occupation therapy, sensory integration, and sometimes other things like physiotherapy or recreation therapy. There are many things that can help the child acquire skills for his muscles to build a more strong and healthy body, skills for his fine motor muscles, the one that helps him to write, even skills for his feeding and eating, building oromotor skills to give him stronger muscles tissue and able to blow and be more able to interact with his peers in school. Many of the programs available are not evidence-based, and we don't recommend to parents to go to things that are new in the market and have not been researched to benefit the child. We always look for what really help the child, and a combination of programs that are evidence-based are available, and many children have been helped. We have many examples of successes and recovery. And as I said, when we say recovery, we're talking about getting the child to become functional and able to learn and succeed until he goes hopefully to college.
So in the speech and communication disorder, some children can't able to speak a word, or even the children who able to speak a words can't go beyond the sentences level. So these are the speech and communication difficulties associated. A part of that, in the non-verbal communication, the children who is still a mute, they can't able to communicate through the eye contact. Even their eye contacts are very poor sometimes, or most of the children have eye contact difficulties. Even they can't follow the joint attention. If I will say to look at the hair, he can't able to follow the instructions. So these are the basic difficulties in the children. And another thing in the speech and language part, we can say they have a habit of echolalia. So the children's, we can't say habit, but children have a echolalia. Whatever you will say, they will repeat the same things. So these are the very common issues other than this ones. And if you look for the physical point of view, the children, you feel that they have a toe walking, they walk over the toes and toes. So we need to look for this, a part of this social communications and the speech and communications and the repetitive behavior. We should have to look for all these issues also.
The most effective treatments available today are applied behavioral analysis (ABA) and occupational, speech and physical therapy, which have proven to be the most effective. Many supposed cures for autism advertised on the internet are not backed through scientific studies and can be harmful.
Really, the treatment for autism is either early intervention or behavioral intervention, and then later as they grow up you have to give them social and communication support to build this knowledge and comprehension of human behavior, because the children really have very low social understanding of the cues and why people are angry or why they are happy, and these are support programs that the child would need as he grows up.
Kids with autism are different from kids with normal language delay. And mainly they come into two categories. We have kids who are minimally verbal, or they used to call them non-verbal, and then we have kids who are verbal. And what's confusing for many parents is that the children, they speak, but they cannot communicate. And the difference is that you can have hundreds of words that you can name cards and say numbers, colors, shape, but they are not able to communicate or ask for their needs. And you need to work in a very specific way with these children to help them improve their communication.
The road to autism recovery begins with diet. That is, choosing foods to add and remove from their diet is the first step to improving the health and well-being of children with autism.
Many parents ask about food, and is the food related to the severity of the behaviors, or can certain diets improve or cure their children? The only thing that is proven is that some percentage of these children, they have gastrointestinal problems, like they are sensitive to wheat and other products. So with these children, they have this gluten-free diet, and it works for them. But the other things like sugar, and like if you eat sugar, you become hyperactive. What you need to know is that attention is not about the body, it's about the brain. someone can be looking at you and they have no clue what you're saying, and someone can be moving and 100% attending to whatever you're saying. So it's not related to the body, it's related to the brain and how you perceive information. So some parents, they just deprive their children of these things, but it has no real proven evidence that this will help in controlling the behaviors.
Some children have a habit to put their foods inside the mouth. They can't able to swallow the properly the foods. Around 20 to 30% we can say the children, or statistical data can say that 20 to 30% children have some difficulty with the food feeding, or their particular taste. Some children have a particular taste, they doesn't like sweet items. Some children like a particular very salty item. So these are the common difficulty also feel.
Children with autism don't have a specific diet. They can eat anything just like us, and if they don't like the certain food, either by the texture of the food or maybe the taste of the food, they don't like it, or sometimes the color of the food, they would just express and say that they don't like it, either by saying no or just pushing the food away. But there's nothing specific for the children that have autism. There's no specific diet for them. So they can eat anything. It just depends on the parent and what they want to feed the child.
There are many things parents can do to help children with autism overcome their challenges. But it's also important to make sure you get the support you need. Being emotionally strong allows you to be the best parent you can be to your child in need.
Now, what parents can do at home, parents notice that these children, they only verbalize or produce words when they are interested in something, like their iPad, or like their favorite food, or like going out or leaving. So what happens is that usually parents, they give these things for them for free, like they allow their children to pull them to get the item or to communicate non-verbally. What parents can do, which is very critical, is to teach the children to verbalize to get the items they want. Because remember that these children have limited social skills. They are not very interested in social praise, like you did a good job or I love you. They're interested in getting the items they want, like their iPad or like their favorite snack or candy. So if parents can make them use their verbal language to request these things, then they will start to learn that everything has a name, and then they learn to use verbalization to acquire or to get the items they need. And that would be the start of their becoming verbal.
Education can play a huge role in the life of any child, but it may be even more important for a child on the autism spectrum. Before choosing your child's educational path, it's important to consider the criteria that make a school the perfect fit for a child with autism.
Many parents ask about the school because this becomes a priority for them. They are like, when the main concern for any parents is the child health, and then after that, when the health is fine, the main concern becomes communication, and after that the main concern becomes the academic. We cannot separate the three. So the main way to mainstream these children is to improve their speech and language skills, because then they can function in a classroom, and to avoid what we know as language-based learning difficulties, is that if they don't have the enough language, they will not function in a normal classroom and they will have difficulties. And so the main way to help them would be to improve their communication, whether verbal and sometimes non-verbal, using devices like augmentative and alternative communication devices. They can communicate normally.
There is little information still available for us to understand why autism is happening, but the way we understand is that there are many factors maybe combined together or maybe acting separately, but every child is unique when it comes to the causes of autism. Many people who have beat the autism and are able to live a normal life. Stephen Shore is an example, Temple Grandin. Dr. Temple Grandin have been awarded as one of the most powerful women in America who have managed through studying animal behavior, and she has been diagnosed when she was little and asked to be put in an institution. So there's no limitation for the child. We have to advise parents to believe that every child have an opportunity to recover, and not necessarily recover autism means he will go back to be typical, but is able to defeat it and learn and get an education and hopefully be functional in the society.
We all need to be more acceptant of children with autism. We need to treat children with autism the same as we treat anyone else. And not only do we need to support children with autism, but we also need to support the families as well in order to help make sure that they get the right support.